This is the journey of Nevaeh Tere. Let's meet Nevaeh. Nevaeh is 49 years old. She used to work as a paralegal in a large law firm. Unfortunately, her health has caused a lot of problems over the years. Nevaeh is overweight and has developed type 2 diabetes, hypertension, high cholesterol, and atrial fibrillation. As a result of her medical conditions, Nevaeh had a stroke 3 years ago and a second stroke recently, which have both left her with significant left-sided limb deficits. This has manifested through her impairment in mobility, the use of a walking stick, and difficulties in activities of daily life. Alongside the stroke, her diabetes control has been fairly poor and has led to other complications including retinopathy, peripheral neuropathy, and renal impairment, as well as affecting her teeth. Nevaeh is currently living in disability accommodation where there are 2 carers for the residents. Her husband brings her meals a few times a week, and she also often receives gifts of chocolate from visitors. Nevaeh's health issues have had a profound effect on her mood as well, and she has consequently battled with ongoing depression. She is often tearful, has trouble sleeping, and sometimes forgets things. Due to her second stroke, Nevaeh is now in hospital in a rehabilitation ward. She has a large team of healthcare professionals looking after her, including doctors, dentists, nurses, dietitians, physiotherapists, pharmacists, and more. Nevaeh's goals for her rehabilitation are to improve her sleep, improve her walking, increase her social interaction, and achieve weight loss. Let's have a look at our healthcare team. On the medical team, our main focus is to address Nevaeh's diabetes management and her cardiovascular risk factors. The best way to first approach this is through weight loss with lifestyle modification, and if unsuccessful, we can consider other medical or surgical options for weight loss. We can also optimize her medical management of her ongoing conditions such as her diabetes and depression, and treat any acute issues as well, like her chest infection.
A full dental evaluation would be carried out, including a clinical exam, radiographs, and a periodontal assessment. Nevaeh would primarily focus on understanding the importance of and improving her oral hygiene by using an electric toothbrush and carrying out interdental cleaning, in conjunction with seeing a dentist regularly for periodontal therapy in order to treat her periodontal disease. Liaising with the dietitian and medical doctor would be key to managing Nevaeh's dental problems.
We want to prevent complications during Nevaeh's hospitalisation by administering medications and collaborating with the physiotherapy team to address mobilisation, falls management, and pressure area care. We will then focus on educating Nevaeh and improving her medication adherence in coordination with the medical, pharmacy, dentistry, and dietetic teams. Nursing staff can also refer Nevaeh to a social worker, find support groups in the community once she is discharged, and organise community nurse visits to make sure that Nevaeh is coping with her medications and care at home.
Nevaeh will be encouraged to work with a diabetes educator, check her blood glucose regularly, and keep a blood sugar log, recording foods eaten whenever the test results are high. A food assessment will be conducted, and the dietitian will then liaise with patient's husband regarding food selection and meal preparation, for example, choosing low GI options, low saturated fat intake, and using a plate model to control portions. Nevaeh would monitor her weight and waist circumference.
The physiotherapy will aim to exercise and strengthen her affected limbs following the stroke, which has implications on her mobility, endurance, and performance of daily activities. Liaising with the occupational therapist can provide her with the equipment needed to carry out self-care and mobility. In the short term, graded strengthening such as group hydrotherapy, gait retraining to normalise her walking, and balance training to address her mobility and fear of falls can be implemented. Alongside education on the importance of physical activity and discharging with a home exercise program, Nevaeh can feel more in charge of her health.
For the pharmacist, we would like to change some of the individual medications to combination medications so we can increase her adherence. We would increase the doses of insulin and add an analgesic to increase her adherence with physiotherapy. For medium term, we will ensure that the carers are able to administer the insulin, and we would like to switch the temazepam to melatonin because there's less dependence and addiction, and we will also teach her sleep hygiene.
By working with a dedicated interprofessional team, Nevaeh will hopefully be able to achieve the best outcomes possible.